Oh, we are live.
This one is a little slower around this portion.
We got our favorite in here today.
Hi. We got Henry, so we're live on Instagram and Henry's live on his Facebook.
I'll turn this
Just
around.
a little bit. We're removing this tattoo.
Tattoo removal in the house.
I guess what I'll probably do is just video the tattoo removal. Almost there, Henry.
Yeah, you. No pain, no
I just
gain.
love the sound.
The popping?
Yeah, it's satisfying. Aww, people love you so much.
That's low.
Who? Him or me? Probably him.
Both.
Probably him.
How's it feeling?
Almost there. You feeling this at all? Even though I numbed it? You still feeling it a little bit?
A little bit.
Almost there. You just got a little bit, so I'm getting closer to that tip. That's what she said. So we're over here. Make sure I don't have that tip in there.
Aw, Deb says she loves us. We love you, Deb.
Okay, so I'm almost. Come around this way.
So the amount of sessions you have to have depends on how dense the tattoo is. So this is my second session, and the first session lightened it up a lot, especially up on top.
Okay, so I'm right at that tip, so just try not to shake it all. Almost there. There.
Well,
Come on, precision. You see? Yeah.
yeah, but anything like in that area, he can fix and adjust and shade and lighten with white tattoo ink. So even he was saying, because he's getting, his name's Mitch, my tattoo artist. He's getting some tattoos removed as well with laser on his neck, and he's on his fourth session, and it's like fucking almost gone.
So what from what I've heard is white tattoo or white pigment, when you try to laser it off, turns jet black. And then you can't get it up. So just,
Yeah, but I'm saying when this is done.
Yeah. Okay, let me put that intensive recovery on you. And last time I wrapped you.
I healed in like less than a week because the face heals so fast. And okay, so usually, you can use, I use this stuff, the intensive, what is it? The intensive recovery?
Intensive
repair?
recovery cream.
Oh my God, I swear, because I swelled for like 2.5 days, 3 days. And, but I use this and it literally, I swear, like on day 4, first of all, it didn't hurt whatsoever. But like on day 4, it was totally,
Way better.
it didn't hurt, but you could feel like all the peely, like stuff was peeling off.
Yeah, what it does is it raises the pigment to the surface and then it flakes off. So do you want me to just keep it like this with this much cream on it, or you want me to put that Aquaphor like I did last time? Remember we wrapped you last time? We put that like Vaseline gauze on and then wrapped it. Do you have a preference?
What's the difference?
I mean, that keeps it, you just walk out with a bandage over your head versus like this. Does it matter?
I mean, I feel like I should put something over it, just lightly though.
Yeah.
See that? Look at that, dude. Look at. Where'd you guys go? Look at how fast that would be.
So,
It's looking so much better. Definitely lighter.
So Gracie, can you go get the
How long does it take to heal? It takes like a couple days.
Yes and no.
It feels like a whole bunch
I
of
know
little
what it
rubber
is, I just don't
bands.
know where.
Go to OR store. It's you'll see flat. It's like
Yeah, the original. So just so
You want me
you
to do it?
know,
What
the
about this
original
one?
tattoo I
So
had,
you open the
the
first
tattoo
drawer,
artist
you
did the
look in.
lines too.
It's on the
Have you ever
left
got a
side
tattoo
back,
where it
and
goes
the
like
next thing
this
is
and it
zero
just
point
bleeds
X.
into it? It's because the tattoo artist just did the lines too close and it just all the ink just spread.
Where? Here?
Yeah, that's why I'm getting it removed. So like for me, like I was telling Sarah earlier, my whole main goal is like this part because everything else I could pretty much get just covered up. But we want to make sure it's all like done perfectly.
I might need two.
Two.
Yeah, I may do.
Okay.
So what I'm doing is I'm removing this tattoo because of that. So the tattoo is Maraki, which means to everything but passion, purpose, and love. It's Greek. But I'm gonna actually get it re-put right back there, but just cute in cursive ink, like really little, really quaint. Big words. Yeah. So dust doesn't get. Yeah, actually that's good. I don't want dust on it. Cause we live in dusty ass LA.
So this is just a petroleum gauze
I love
that I'm
petroleum.
putting over.
Yeah, that was really good. So before I went on live, you did what is it? A block?
I did a ring block. I did local anesthetic around in a circle to then numb everything in the center.
Mhm.
But we did put numbing cream in the center too.
Mhm.
Yep. Hold on, my things are so slippery. I can't move this over. Okay, I need the gauze. So let's clear it off. I need the gauze and I need tape.
Oh,
Which kind of tape do you want?
how are you guys?
Maybe the paper tape or something.
Like one of these two?
Yeah, the white's good.
Yeah, give me all the nutrition.
So yeah, so that was pretty quick. It takes more. It's like just like anything. Sometimes the setup is more than the actual
Yeah, for real.
procedure. You know.
Look at the fatter roll.
Okay.
All lubed up.
Or get the other see the one that's like brown skin. Yeah.
Oh, Janet. Oh, sorry, Henry. Now look at my. Wow, they're gonna disrespect me so much with that one. Oh my God, my head's all numb right here. Such a quick process. Yeah, I feel like nobody ever shows their tattoo removals, what they're getting them done. So I was just like, this is like such a cool process to like film. I would have filmed like all of the like the injectables, but like for me it's just I don't want Facebook. You know Facebook. I already have
I need scissors.
I have a criminal record on Facebook, so.
Well, that all stems from Justin, right?
What?
Stem from your surgery with
I
Justin.
mean, it started with him, but also me like fighting with people online is probably not the like smartest thing for me to do. Everybody has an opinion, and I have a rebuttal.
Is that too loose or it's good?
No, that's perfect.
Yeah, this is not sticky, but it sticks to itself. It's weird.
Yeah, I feel like I bought some of this on. So. Yeah, yo.
Let me have you cinch up a little bit.
Ooh.
So that was procedure number 2, tattoo removal.
I'm so excited.
We can do the progress as we go along.
Yeah. Oh yeah, that's what we should do next time is like
Show it.
like film.
I have both. I have photos from the start, and then I have photos from today. So before we did this one, before we did this procedure.
Oh, I
so
forgot
it's
you did take the photos
like,
today.
every time. Yeah.
How many more lasers? So we're gonna. So remember, it depends for every person.
Yeah.
TBD. I was gonna say something perverted and but I'm changing my ways. I'm changing my ways. Oh hi. So yeah. So hopefully less hopefully it takes like.
My guess is around 6, but it could be plus or minus that.
Bitch, it better not be plus that. No, but it all depends. But this is a real dense tattoo.
Yeah, I mean, this is the best settings. You know, it's professional, dense. I use all the best settings on it, so it should come up with no problem.
She said, I just got this old lady called me a liar. I called all on Facebook because they're so strict now, and he commented on his friend. He's all, yes, bitch, and he got fucking put in Facebook jail.
No.
Really?
Yeah.
You said bitch?
Yeah.
Wow.
Oh
I
man.
was just like, damn. So if you're on live, you can say stuff, but like typing it out, they grab on. So like my friend Bianca came on to my live and she said the same thing, and she also got like put in Facebook jail.
Oh.
And it was because Facebook will literally be quick.
Censor certain
We
words.
thought at first it was because somebody reported her, but it was just because Facebook censored her because I had to go because they sent it to me saying like this person said this, so then I can go and like I had to like report it, so she got taken out. So she would
They're
get
super
taken.
strict about a lot of stuff.
Yeah.
But then they're not about others. I don't know, it's weird.
Yeah.
You know, we put for like a stimulus package, we said Botox at a reduced price if they bought the whole vial, or fillers at a reduced price. We put them on our Facebook account for purchase, and they took away our ability to charge through Facebook. So we had to take them off because that was for the other practice, not the skincare. But we put on the skincare's website just to make it easier.
Probably thought we were selling on the black market or something.
Damn.
Yeah, they hate that, so we had to change that.
Facebook's getting crazy, yo. Well, still, oh my god, look at my hair all crazy right now. Yes.
So awesome. So until next time.
Okay,
You know,
guys.
if you think you healed up really fast, so maybe we don't have to wait. This was what, 6 weeks away or 4 weeks from our last one?
It was 6.
Then you
because 4, no, I think it was 5 because I wanted, because we were going to do 4, but I think
You
you guys had,
postponed
no, you guys said, well, I think we can do it the week after.
Oh.
So.
Yeah, no, we don't have to wait that long.
Okay.
We probably need to wait 3 to 4 weeks. Depends how you heal. If you think you're fully healed
Yeah.
in 2 weeks, then we could probably do it as early as 3 weeks. You know,
Let me
just
put my
depends.
hat back on because this is so disrespectful right now. No, I'm so down.
Yeah.
Oh,
It's so dark out.
hold on, you
I
guys.
know.
It's like 10 p.m.
What are we doing next, Dr. Sarah?
We're gonna do a peel. Skip
Yay!
peel. Perfect peel.
And you do lives on your Instagrams, right?
Yep.
Every Wednesday at 5 p.m.
Okay, so every Wednesday at 5 p.m. on Dr. Sarah's Instagram, which is right here. It's Dr.
Dr. Sarah period Yovino.
But I put it right here in the description box, so you know. I feel
And
fine.
they should pay attention to December 2nd, which is my birthday.
Okay.
And we're going to be doing giveaways.
Okay, so December 2nd giveaways, so that could be a lot of stuff. So
It could be
Tune in.
fun,
Henry,
especially for the locals.
oh I know, right? Oh yeah, so you're local, which is meaning Southern California.
Yeah.
Bitch. I hope you don't. I swelled up. It was so funny. I swelled up so fast and it went away so fast. It was literally like I was hoping my.
I feel like you're getting a little, I don't know if it's from the push of that, but I feel like it's starting on your upper eyelid right now. A little bit.
A little bit.
No, this eye. Remember, I have a lazy eye. So
No,
this.
but this is looking a little bit puffy to me right there.
Oh, shit, I hope I do, bitch. I'm gonna take more pictures. I took pictures with like my hair all up, and it was amazing. Okay, guys, I'm gonna let you guys go. I'm gonna go. I'll go back live when I get back to my house, but I'm gonna go get. Isn't there a Subway right here?
Yeah. There's
Yeah.
one right on Little Santa Monica, and then there was one. Is
I
it
think there's
still
a-
on?
On
Oh,
Wilshire.
sure.
On Wilshire.
Are they still
Yeah,
there?
right
I think
across
they're
that.
still open.
I think
Yeah,
they are,
Yeah. Okay, I'm gonna get something to eat, then go home, and then I'll come back online. All right, see you guys in a little bit. Bye.
We're staying on.
Awesome. Okay, so we're gonna just flip the room.
Yep.
And we can talk in there if you want, Ashley. But, you know,
Okay.
Ooh.
All right. So we are flipping the room right now. Me and Gracie in the house.
Behind the scenes.
Gracie, let's get a little look of your lips.
Oh yeah, it has been
Yeah.
a few weeks now.
They look so good. How are you liking them?
You know, I had really never thought about getting my lips done before, but now I look in the mirror and I'm like,
So glad you did it.
decision.
Yeah,
Decision.
they
I
look
feel
good.
Like they're symmetrical now,
Yeah.
which they never were before.
Right.
So.
I'm gonna flip this thing around. We did mine. I don't remember when we did mine, but we did mine not that long ago. Gonna be waving at everyone. Hey everyone. So if you're coming over to our live from Henry's live, Henry from Hank and Henry was just here. He's still here, but we did his second tattoo removal, and we are now getting ready to do a chemical peel on another patient of ours. These are two of our popular procedures, tattoo removal and let's see, a chemical peel. We do chemical peels a lot. We are officially in peel season. As you can tell, it is dark outside, and you really want to do peels when you know you're going to be out of the sun and not exposed, not tanning your skin or anything like that. So chemical peel, Dr. Sarah says it best. It's like dry cleaning your skin. So if you are someone who has discoloration, has fine lines and wrinkles, anything that you really feel like your skin is kind of bothering you, chemical peel is something that, a lot of people benefit from. So we're excited to have our patient come in and get ready for their chemical peel. If you guys have any questions.
About to bring him in.
Yeah. Grace is going to go get our patient. If you guys have questions about anything aesthetic, Botox, filler, surgical procedures, anything like that, you should let us know, and we can answer it during our live with Dr. Sarah. We can ask the doctor. So I'll show you guys our setup for the chemical peel. We use what's called the Perfect Derma Peel. And this is how Dr. Sarah's set up for that. Patient will come in here nice and relaxed, and we will get started. How's everyone doing today? Sure. Maybe you guys are taking a break from watching the news or something. All right, I think we got our patient coming in. Dun, da, da, da. Go ahead.
So you can go ahead and take off your mask since you did swish with the mouthwash with hydrogen peroxide.
So the chemical peel, I'll just flip this right now. The chemical peel doesn't really hurt, right? It's stingy. It feels a little, it could burn, which is why we always give patients the fan. But it does not hurt. No, it is not intended to hurt you.
Some people don't even need the fan.
Right. Yeah, you're in the room. What do you see, Gracie?
People, like the worst reaction I've ever seen is someone going like this.
Right, because it's just a little stingy, that's all.
That's the worst I've seen.
It's like a little stingy.
Or like the smell is kind of strong.
Mm-hmm.
Yeah.
And why did you want to get a chemical peel?
I wanted to remove the spots that were on my face.
Yeah. And how did you hear about our office?
My sister actually came here.
Oh, awesome.
So she recommended you guys.
That's
You guys
good.
did great work.
Did she get a chemical peel?
She did, her and her boyfriend.
Nice.
Yeah.
It's something that men should do, right? Like basic skincare, something that men should do. And so we think it's great that you're here to get a little dry cleaning of the skin. That's what we like to call it.
So before he came into this room, he washed his face and he swished with a mouth rinse.
Mm-hmm.
So those are the things that you're going to do to prepare for the chemical peel.
Awesome. And Gracie, does Dr. Sarah have patients like not go in the sun before the chemical peel, right? Or is it more so just after?
It's more so just after.
Mm-hmm.
But if you have like a super dark skin tone, like a little darker than Ulysses, then she would recommend pre-treating with hydroquinone.
Okay. To what? Lighten?
Yeah, it's just to kind of get your skin ready and prepared so it's not like introducing something harsh.
Right.
Pretty much.
So this is our setup. We use the Perfect Derma Peel. A lot of people I know when quarantine started were ordering what's called like the Cosmolon peel and certain peels that you can do at home. This is not that peel. You need a physician to apply this peel because it's really strong and powerful. How many sessions for a chemical peel? So it's not necessarily like a session thing, right? You don't need sessions, but it all depends on what you're working with on your skin. So you'll see improvement for sure after the first one. If you need to come back and be treated again, you can do that. We just need to give you enough time for your skin to heal in between. You will peel like a snake kind of sheds its skin. It comes off in big, large chunks. So it's a lot of fun. And now, dun, da, da, da.
Hi, how are you? Nice to meet you.
Nice to meet you.
So we're gonna do a peel.
Yep.
Did you wash your face?
Yes.
Awesome.
Face has been cleansed.
Okay.
Swish.
So we're gonna show you how easy this is. Okay.
Yes.
You prefer to have my mask on? You passed the COVID test, right?
Yes.
Okay, good. So, I don't know if did you guys go over this and all the stuff that's
A
in it?
little bit.
Yeah.
Okay.
I would just do it again if I were you.
Okay, so when we're done, you're going to get, where's the cleanser?
Let's see. Oh, does this one not have a cleanser in it? Let's grab one.
Okay. So you're going to get a few things. So today you do nothing. Okay, you're gonna go home. You're gonna leave everything on that I put on you, and you're gonna do nothing until tomorrow morning. So your homework starts tomorrow. And you have two things: one in the morning, one at night. Okay, so you wash your face with this cleanser. Here's more of that cleanser. There's two applications of the cleanser in here. So I suggest cutting off the corner and taking half of it out, washing your face with half of this, and then you're going to get one toilette. This is going to have more peel in it. You're going to take it out, don't open it all the way, put it all over your face, and then when it feels dry, flip it, use the other side, and then you're going to turn it inside out. You're going to use one side, flip it, use the other side, all over everywhere we put the peel. Okay, then you're going to slowly open it, more, slowly open it, more, until it's fully open and dry. Okay, then you're going to throw it out, and you're done until the nighttime.
Got it. Okay.
And you'll see when I put the peel on you, the peel will keep your skin feeling kind of wet for a little bit of time. So the most important thing is the nighttime one. You want to make sure you do about an hour before you go to sleep. And you're going to get the second toilette, open it up and do the same process and put it on. You're going to start to feel very kind of like itchy and dry. If you feel super itchy, this cream has hydrocortisone in it. Okay? So it's an anti-inflammatory cream. If you think that you're very itchy and like you can't really, like you're having a hard time sleeping, some people get like that, I get like that personally, then I would suggest that you take Benadryl by mouth. Benadryl cuts down any kind of inflammation and itchiness and histamine reaction. So you'll cut that down, you'll be able to sleep with no problem. Okay, and then you're gonna, when you wake up, you're just gonna cleanse your face and pat it dry, don't scrub, don't anything. And then you're gonna wait until you start to peel. So today's Wednesday, you're gonna start to peel around the corners of your mouth and nose Friday night, but all your peeling is gonna be Saturday and Sunday. Okay, when you start to peel and it's gonna start to shed from here and go right, like out to the periphery, do not pick the pieces. Don't pick, pull, prematurely try to take them off. Let them fall on their own. You'll scar yourself if you pull. Okay, you can cut close to the skin if you're seeing it flap, because you'll see it out of your peripheral vision. Then you just take scissors, make sure you alcohol the scissors and cut close to your skin. Okay? And then also before you start to peel, from now until then, you do not want to trap heat under the skin. So anything that involves your body temperature rising, you want to avoid. That's vigorous exercise, a hot jacuzzi, a steaming hot shower. Okay? You could blister if that happens.
Got it.
Perfect. That's it. So lay back. I'm going to put a little bit of Vaseline. Oh, that's okay. In the corners of your mouth. Can you just raise that physically?
Yeah, absolutely.
All right, everyone. So send us your questions.
So we're doing the perfect peel today. It's a great peel. It contains 6 different ingredients. It contains glutathione, retinol, vitamin C, phenol, kojic acid, and glutathione. TCA.
TCA.
Yes. So it contains those things. Here it is right here, pouring it in. Now for him, because of the skin and everything, I'm going to do a booster that's going to intensify the peel, make it stronger than normal, because I feel like he needs that. So I'm going to be opening this. It's so easy to open. So hold on, I'm getting there. Did I mess that up? Yeah, I kind of did. Can you give me the clamp? That's, I think that's Sash. Yeah, that's yes. Thanks.
And Dr. Sarah, I was kind of telling people we are in peel season.
Yeah.
And why is that?
Because, generally, I'll just pull this out. Generally, once you shed out that outer layer of skin, you really want to avoid sun exposure. And so now, since it's cooler, people are going to the beach, not laying out in the sun. They're not as concerned about their tan. They're more concerned about clearing up their complexion. And so I'm just going to put this at the corner of your mouth. So when you use that toilette, make sure you avoid the corners of your mouth. Okay? Also, question, I'm going to avoid that area where the mustache, where your goatee is, right?
Dr. Sarah, does this help with fine lines?
It does. There are boosters that are, make the peel double the strength, and that is for fine lines and wrinkles. And then there's boosters for acne. There's, but it will help fine lines and wrinkles. It will help smooth out the skin, lighten the skin a little bit. So
they're in the box.
Okay, great.
So this is acetone.
Yep.
What it does is it takes off the remaining grease that you may have, oil and grease on his skin, and it allows penetration of the peel better than without it. Okay. Looks like you even have a little melasma here close to your hairline as well. So it's a little bit stinky. This is what women smell when they take off their nail polish. And then let me see underneath. You don't really have any issues underneath your chin, right? I'll also go there. Okay. Gracie, can I get new gloves too?
Yes.
Okay, so we are doing the perfect peel. I'm gonna basically paint it on him. In multiple different layers. So he's got a little fan in case he is feeling a little bit of stinging.
A little heat.
And I'm going to be pressing down. So here we go.
It does have a distinct
Odor.
I was going to say aroma. We always know when Dr. Sarah's doing peels in the office.
So you can see it kind of going on. No one's going to know that he even had it done, really. It blends in with the skin very well. You can see here. So he's got some hyperpigmentation spots that he wants to address. And so the peel is going to really help lighten those spots.
Can foundation be applied after a chemical peel?
I wouldn't suggest to apply it the day that you get this peel, but once you're done with those toilettes, then you can put it on.
Okay.
But you wouldn't put it on over this.
Okay.
And most women, you can't even really tell that he has it. It is giving a little bit of color to him, as if he has a mini spray tan or something. But when it's all said and done, no one's really going to know he even had it done.
Right.
And then, especially on day 2, 3, no one's going to know he even has it on. He's going to feel tight.
Oh, he's working the fan.
He's trying to.
How you feeling?
It stings a little. It's not too bad.
Yeah, you can fan yourself if you feel
Yeah.
Feel free to do that. So we're putting it on here. This is the perfect derma peel. So I'm just going back over it. For certain darker spots, like these darker spots, he may need another peel.
Yeah, how many do patients typically need? What's a good...
Most patients get one.
Okay.
But every now and then you'll get a patient that has other issues that are really prominent that they want to take care of. Or if they have like severe acne or, acne scars or this or that, they're going to one peel.
Right.
But like I only use one peel. Gracie only needs one peel. Ashley would only need one peel.
And how many times, like, what's good for maintenance? Like, how many times?
Once a year.
Once a year. That's all you need to do is one peel a year. Wow.
As long as you're using good quality skincare and other things like that, and you don't need another peel. But if that's the average person. But if you have acne, you're gonna need to do it more often, most likely.
Yes.
And couple it with other things like IPL to kill your acne, or acne, skincare products, or other things, retinols, or things like that. So you can see this is called frosting. So he's gonna shed all that dead skin off. You see how it's kind of like white?
Yeah.
It's called frosting. So
Interesting. Oh, I see it. Yeah, for
it's
sure.
feel great. You can
Wow. Does it help with pores?
It does. It can help shrink them a little bit. It's not transformative. It's not
Right.
like microneedling or
Right.
laser would be. But it does help tighten the skin a little bit
Okay.
and smooth things out. But I definitely think like microneedling or lasers are much more
I
effective.
see the frosting.
Yeah, are much more effective at treating large pores. Yep. So here we are doing a skin peel.
We do these a lot. It's great for just maintenance of your skin to help really dry clean the skin, as Dr. Sarah says. One of my favorite ways to describe the peel.
And if he was older or had a lot of like issues around his eyes, I would do the eye area too. But you don't. He doesn't really need it. I'll just go close once, but he doesn't really need it on the upper lid. So we're going around here. We're trying to treat these darker spots and all his discoloration. You can even see some discoloration here above his mustache too, or his goatee.
The perfect peel is $350 for those asking.
Well, it's $300 and then
$300
$50 for the bonus.
Yes, $300 and then $50 for the booster.
For the booster.
And who typically needs a booster?
Somebody that has like excessive hyperpigmentation, somebody has excessive acne, somebody who has a lot of fine lines and wrinkles and wants to really smooth them out. That's who typically gets the boosters.
How you feeling?
I feel great.
Good.
How's the stinginess?
It stings a little.
Yeah?
Not too bad,
A
though.
little bit here too, so you get a little bit right there. Even though your skin there looks nice. So, you came because you got referred by your cousin or something?
My sister.
Your sister, okay.
My older sister. I saw her whole process happen.
Aww.
Yeah. Well, welcome. We love family.
Well, guys, keep your questions coming for Dr. Sarah. It doesn't necessarily have to be about the peel. It can be about Botox, fillers, our laser, some non-invasive skin
Yeah,
tightening.
we just did tattoo removal on Henry, for those of you that were able to see that. So this is me, I'm just layering on the peel on him. This peel contains 6 different ingredients. It contains, the main thing is glutathione and TCA, but it also has phenol, retinol, vitamin C, and kojic acid, which some of those are lightening agents, some of those are peeling agents, some of those, but they all help to lighten and shed the outer layers of skin. So he's going to shed, layers off of him.
Wow.
And so today's Wednesday. He's really going to notice that the peeling is going to start Friday night, like around high movement areas, which is typically like around the mouth.
Okay.
Basically, is the easiest way to say it. Like edges of the mouth down here is the first place that typically peels on most people, and then around the nose here from the stretching of the face. And then that's going to be Friday night, but he's really going to peel all Saturday, all Sunday. And Monday, he may have a little bit of peeling remnants in the hairline. A little bit. But since he's getting the booster, his might be stretched out a little bit because he is getting the booster. So he may have 2 peeling sessions. He may peel once and then he may peel again.
Okay, got a couple questions.
Okay.
Procedure for mild rosacea.
Okay, so we have IPL for that. We also have a skincare product called Erase Paste, which is also very good for rosacea as well.
you could do a nice combo of the IPL and then get the erase paste to maintain
your results.
Mm-hmm.
But typically rosacea requires a few IPL treatments, but we start with, say, a series of 3 and see how you've responded to that.
Is this better than a deep cleanse facial?
Yes.
1,000%, by the way.
This will shed all your dead dermal layers off and leave you with fresh, bright skin. Tighten your skin, shrink your pores, and lighten these darker spots.
And what caused these darker spots?
They're hyperpigmentation spots. It's just excess melanin keratinocytes, and just hardening of the skin.
Okay.
It's just dead skin that's piling up that will just shed off.
Wow, I'm so excited to see his results.
I know. You got to send us photos.
Yeah, you have to come back in and see us.
Of the peeling, or even just text us the peeling process.
Right. Yeah, we love to see that. If you have any crazy...
Have your sisters send them.
Send photos.
I will.
Or somebody should take them of you, because sometimes it's hard to take them of yourself. But we love showing peeling, in action.
Mm-hmm.
So I'm just layering it. So see how you're like sopping wet kind of with the peel?
Yep.
That's what I'm saying about your nighttime one. Like it's going to make you feel kind of wet for a while.
I was thinking about it. Our last 2 behind the beauty procedures that we've done in office have all been guys. So fellas, your skin needs love too.
So Henry's going to come back for his 3rd texture removal, and he's coming back on my birthday.
Oh, perfect.
So my birthday, we're doing a bunch of giveaways.
December 2nd.
December 2nd. Stay tuned. We will be giving away some things for fun. Celebrate my big birthday.
Woohoo.
But actually, I'm going to Palm Springs to celebrate my birthday. But yeah. Can't wait. So still layering this on. We just got a little bit of peel left.
We do not let a drop go to waste.
Nope. This is the end of it. But see how it's like still so wet? Give me that. Can I have this? So I'm just going to help speed up the drying process here. But you can see all the frosting. You're going to peel like crazy.
Oh my gosh, I can't wait. I'm so excited.
And I put a little Vaseline. That's not drool. He's not drooling on
Okay.
That's Vaseline at the corners of his mouth. Is your sister watching the live? Is she going to watch the live? Does she know you're going live with us?
She's not. She's in Mexico.
Oh.
Oh, must be nice.
Yeah.
I'm so excited to see
How long she
how
going
it
for a
feels.
week?
Yeah, I think so.
Nice. You should go to Tulum?
No, she went to Chavas.
Oh, I never heard of that. Where's that?
Somewhere in Mexico.
Ah,
It sounds exotic.
it does. All right, so you're putting the last couple drops
Yeah, I'm
on?
going to do it right where I want to peel it. Like this one is the bad one. And then we got this one up here. And then we got this one over here. We do have other peels too. We have lighter peels for people that don't want to peel like a snake.
Mm-hmm.
We have ones that are very, very light, like a salicylic acid one that you don't really notice the peeling, but you peel a little bit of outer layer and just have a brighter glow.
Mm-hmm.
But you don't necessarily peel.
Mm-hmm.
And then we have like a mid-range peel where you peel a little bit, and it's good for people that are like, super sensitive.
Mm-hmm.
And then we have deeper peels like this one.
So for those just joining,
And we can make this deeper peel even deeper by putting boosters like we did for him.
we are doing a chemical peel, the perfect peel.
We are finishing up the peel here.
Yep.
I'm just kind of pushing it into skin so it absorbs better. Everywhere I really want it to really soak in. So you might need a second peel, especially for these deeper spots. And you stopped the retinol and everything before, right?
Correct.
You're like, no, I didn't stop it. Yeah.
Awesome.
So that is it.
Wow, that was easy. You can
Okay,
come and
so-
get this on a little afternoon break.
For those of you that did not hear my whole thing beforehand, so he washed his face with his cleanser. Here's more of the cleanser. So he's going to do nothing today. So he's going to go
He's
home.
set.
He's set. He's going to go home. He's just going to let it dry, relax. He's going to fall asleep with it on. And then you can see it's like no one can really tell he even has it on. He's a little shiny, but that will dry. And no one will even know that he has any peel on. So he can do whatever he wants except exercise tonight, which, do you exercise every day? Okay. So we don't have to worry about him exercising. But he's going to get more of the perfect cleanser. So this is what he washed his face with. He's going to cut it off. He's going to use half of it tomorrow morning. Do you take a shower in the morning, night, both?
Morning.
Okay, same thing. So he's going to shower in the morning, put this in the shower, take half of it, wash his face, get out, pat it dry gently. And then he's going to have one toilet for the morning. He's going to open it up, not open it up all the way, use one side, flip it, use the other side, do it inside out, one side, the other side till it's dry, and then slowly open it, but can keep doing it all over the area until it's dry, and then he's done for tomorrow morning.
Okay.
And then tomorrow evening, he's going to repeat the same process with the second toilet. So he's got one cleanser for 2 applications and 2 toilettes, morning and night.
Okay.
The night one, you're going to do an hour before you go to sleep because you want the peel to dry on your face, not on your pillow. Okay? So that's for tomorrow. Nothing today. He's going to have his homework tomorrow. And then he's got 2 creams that come with it. One is a moisturizer, post-peel moisturizer. So if you feel very itchy or your face is super irritated or once you've peeled off nicely, you want to put on your nice new skin, this has some hydrocortisone, which is anti-inflammatory. You can use this. This one says post-peel moisturizer. Okay? Then you have sunscreen. You always want to cover your face with sunscreen if you happen to be out, but you should just wear a hat, and cover your face and not be out in the sun right now, okay? So here's these 2, and then in case you forgot everything I said, it tells you every day and what you should expect throughout the days.
Great.
Okay, past day 7. If you want to use, I know you're taking retinol and those kind of things, you can start using those after you're fully done peeling. So in your case, because I used the booster on you, you might have 2 peeling sessions. So wait until you feel like your face is back to normal and you're not going to peel anymore, and then you can resume it. So in a normal person without the booster, it's typically around day 7 to 10. It might be 14 days later, okay? Remember, do not exercise or trap heat under the skin, no jacuzzi, don't vigorous exercise, and don't get in a steaming hot shower until you start to peel. So for the next 48 hours to 72 hours, don't do that. Once you start to see the peeling happen, don't pull the pieces. You're prone to hyperpigmenting, I can tell by the other spots. You will hyperpigment, and you also pull some good skin with it. So you don't want to do that.
Okay.
Okay? This is for you.
Doctor's orders.
Doctor's orders.
Great.
All done.
So we're all finished. Anybody have any peel questions?
Um,
That peel contains 6 different things in it.
can the spots come back?
If he
Picks.
picks them
Yeah.
or pokes them or he gets another breakout, the most important thing is since you're using retinol, don't pick your breakouts as much as you can. And if you just try not to overpick it too. Like if you can't stand it because you see a whitehead, you get it out. But don't overdo it because you're going to build like a callus. Basically, those are like calluses,
During the peeling process, can he use sunscreen if he goes outdoors?
The sunscreen that comes with it.
Perfect.
So remember, there was a sunscreen that comes with this. SPF 50, I think. Oh, this one's 30. SPF 30 comes with it. You're going to use this. Once you're going to feel super dry. So today you feel kind of like wet or whatever until it dries. And then tomorrow when you do the second toilet, you're going to feel drier. On the 3rd day, you're going to feel super dry, like and tight. That's when you start to peel at night. When you feel dry and tight, you may feel like, I got to over moisturize my skin or I got to put moisturizer on. I think the less you moisturize, the more you'll peel, so it's better not to over moisturize your face at that point. Okay? But it's here in case you feel like you need it.
Okay.
Okay?
Perfect.
Yeah. And then 6 ingredients: glutathione, TCA, kojic acid, retinol, vitamin C, and phenol are all in this peel.
Awesome.
So
How was it?
It was great.
Was it what you expected? Like what did you think? Like, what did you think would happen? Did you have any idea? Or did you...
I had no idea, honestly. So.
And so, what did how was it compared to what did it hurt more than you thought? Was it?
No, it stung a little. It wasn't too bad though.
Yeah.
Definitely recommend it.
Awesome. Perfect.
Okay.
Well, thanks, guys.
Thank you.
Thanks for watching Behind the Beauty.
Bye.
We'll see you next Wednesday.